the tibial shaft. Okay, so you have it's called metaphyseal dissociation. You have a fracture line here. You have a fracture line going here. Okay. These are usually high energy injuries. One thing we really worry about with these injuries is compartment syndrome. Compartment syndrome is when you damage the soft tissue, you get a lot of swelling. Okay, your muscles are surrounded by fascia. Fascia is this, think of it as a stiff bag that holds your muscles, okay? If you fill that bag up, you're restricted by the dimensions of the bag. So if you get too much swelling within the bag, you can't swell out, you start compressing in, you can constrict blood vessels, nerves, okay? So we're gonna be watching carefully for increasing pain. Any numbness or tingling, you gotta let us know right away, okay? We're gonna elevate the leg.
Okay.
Looking at the x-rays, there's some concern that the knee might also be dislocated.
Okay.
Okay, so we have to get that relocated now.
Yeah.
Okay, you're gonna give you something for pain. I'm gonna try to straighten you back out. Okay, we're gonna get ABIs, which we're looking at blood flow. We wanna make sure that it's equal in this leg and this leg, make sure there's not a vascular injury.
Okay.
Okay, then you're gonna put you in a long leg splint. The splint's gonna go from your groin all the way down your leg and your foot.
Yeah.
Okay?
All right.
Don't eat anything. Okay, I'm going to talk to the boss and see how fast we can get you to the OR. With these injuries, sometimes we delay based on soft tissue swelling. So soft tissue swelling, if you're too swollen, it's not safe to go to surgery, because if you open up, it's going to be tough to close and get wound healing complications, all kinds of problems. Okay? Eventually, you will need surgery that either plates and screws. Let's look at the x-ray again. You can probably fix it just with plates and screws, okay? Probably a couple. Okay, before that you might get an X-Fix. It's likely that you'll get an X-Fix. An X-Fix is, there's a device you're gonna have pins going into your leg, pins going into your thigh. It's gonna span your knee and stabilize you.
Okay.
Okay, and that'll stay on until the soft tissue swelling goes down, until it's safe for surgery. But to make sure that you're not moving there. One, protects nerves, blood vessels. Two, lets the soft tissue calm down. Okay. So, as soon as they get something for you, a line for you, and give you some pain medicine, I'm going to try to straighten you back out. Okay, I want to see if you're dislocated.
Do you want? They were going to try to take her for ABIs as soon as I was done for this. Do you want to do that before the ABIs?
I'd like to straighten her out first.
Okay,
yeah.
I'll call them and let them know.
Can you repeat again what kind of tibial fracture did you say? Shaster 6?
It's a Shasker, we call it a Shasker. So the most common classification system we use for tibial plateaus is the Shasker classification. 6 is, she has a tibial plateau fracture, so she has a fracture involving the weight bearing surface of her tibia, and she also has a fracture through the shaft. Right here is the proximal end of the shaft, the top part of the shaft.
Okay.
Okay, and she's separated the metaphysis and the diaphysis. So she has a fracture through about here, and she has a fracture here.
Okay. So it does affect her patella as well?
No.
Or just maybe a dislocation?
Maybe.
Okay.
Yeah.
All right. Thank you for explaining that.